ABG or arterial blood gases is a blood test that measures the level of oxygen and carbon dioxide in the blood, as well as the blood's acidity and other parameters to evaluate respiratory and metabolic function. The lungs regulate carbon dioxide while the kidneys manage bicarbonate levels. The presence of excess carbon dioxide in the blood results in acidity, while the concentration of bicarbonate in the blood indicates its alkaline nature. The normal value for pH is between 7.35 to 7.45. For carbon dioxide, it is 35 to 45, and for bicarbonate, it is 22 to 26. When interpreting ABG results, three key factors come into play. Is it indicative of acidic or alkaline? Does it stem from a metabolic or respiratory source? Is there any evidence of compensatory reaction? Our initial step is to determine the pH direction. If it is low, it indicates acidosis, while high pH suggests alkalosis. Then examine the pH and carbon dioxide levels. If both show the same trend, it suggests a metabolic issue, meaning if pH and carbon dioxide is low, it is metabolic acidosis. If pH and carbon dioxide is above normal, it is metabolic alkalosis. While opposing trend indicates a respiratory problem, meaning if pH is low and carbon dioxide is above normal, that is respiratory acidosis. If pH is above normal and carbon dioxide is low, that is respiratory alkalosis. But this does not provide a clear indication of whether there is compensation or not. The respiratory and renal systems regulate blood pH by adjusting bicarbonate or carbon dioxide levels when it's too high or too low. Partial compensation occurs when one system tries to restore blood pH. Full compensation happens when both systems work together to normalize blood pH. Although 7.35 to 7.45 is a normal range, but the standard is 7.4, meaning if the pH below 7.4, it indicates an acidic condition within normal limits, whereas a pH above 7.4 signals an alkaline condition within the spectrum. So the first example is pH 7.2, which indicates acidity, whereas carbon dioxide is 49, which is high, meaning it is respiratory acidosis. And if we can see the bicarbonate level, which is within normal limits, meaning there is no compensation yet. So this is respiratory acidosis without compensation. In the next example, the pH is 7.22, which is low. Carbon dioxide is 49, which is above normal. So meaning it is respiratory acidosis. And at the same time, we can see bicarbonate, which is also above normal. So here the compensation is happening, and we can say this is partially compensated respiratory acidosis, because here kidneys are trying to normalize the pH, but pH is not normal yet. In this example, pH is 7.37, which is normal. Carbon dioxide is 33, which is low, and bicarbonate is 17, which is also low. And it is fully compensated metabolic acidosis, meaning it reduces carbon dioxide to make the blood more alkalotic, pushing the pH higher, but is still remaining on the acidotic side. The next example shows pH 7.42, which is normal. Carbon dioxide is 32 and it is low, and bicarbonate is 18 and it is also low. And this is respiratory alkalosis with full compensation. Although the blood pH is normal, The carbon dioxide and bicarbonate levels are abnormal. To determine if it's metabolic or respiratory, we check which side of the pH spectrum it falls on, and in this case, it's on the alkalotic side. When bicarbonate decreases, it helps bring the high alkalotic blood back to normal. Thanks for watching. Do not forget to like and subscribe.